This is One on One. Steve Adubato here, coming to you from the Healthcare Foundation in New Jersey. Just finished a very comprehensive, honest dialogue called Breaking the Cycle of Teen Abuse and Bullying. We are joined now after this conversation by Marcy Felsenfeld, who is Senior Program Officer, Healthcare Foundation of New Jersey. Marcy, thank you for joining us. And I said, by the way, let's put some context into this. We're not going to be broadcasting the conversation we had with 9 really top professionals, folks who deal with bullying, teen bullying and abuse. What was your biggest takeaway from it?
No one entity can address these issues. It has to be a multidisciplinary approach. It has to be schools and parents and psychologists and social workers and community centers and houses of worship.
Let's do this. Let's go back, though. Defining. Like someone says, well, bullying and abuse. Everybody knows what that is. What does it look like? Teen bullying and abuse.
Teen bullying and abuse, in short, is one teen trying to exert power over another.
Can happen where?
It can happen online. It can happen in person. It can happen anywhere. But it typically does not happen one-on-one. It typically happens with an audience, whether that's an online audience or an in-person audience. It takes place with people watching, because that's what gives the bully the power that he or she is seeking.
One of the things that happened in the forum that we had as well, there are so many different points of view on this because people come at it from different perspectives. One of the things that we talked about is, hey, we needed to identify solutions, more recommendations for what works. And you said there is no one size fits all, and some things work for some people, don't work for others. Should we be debating what works, or just?
I think that the best solution is to bring representatives, people who work with teens in different settings, who work with families, who work with students together to address the issue, because a school in and of itself cannot address all of the social and emotional learning that a child must have in order to become a kind, caring, and thoughtful adult.
And there was a big discussion about that. Hey, many of the children that, and by the way, it could be children in urban, suburban area, it doesn't matter, socioeconomic status, et cetera. But there was a discussion like, hey, the school should be doing this. And then we got into an honest conversation, sometimes uncomfortable conversation. Well, really, is that what we expect from school administrators, from teachers, with all the other challenges? Well, yeah, let's have, no disrespect to gym teachers, let's have the phys ed teacher pick up the responsibility for being the leader in the school for the anti-bullying and abuse program, you say?
Well, I think that so many of the problems that we face in society are systemic. So you can talk to a physician about the fact that a patient is not compliant with treatment because they don't have a home. Well, how does a physician address that? There's a system that works that blankets the physician that should blanket the physician with supportive services, so that these issues that lead to people being unable to maintain health
social determinants
can be addressed.
Of health.
And I think you can think of it the same way in an education system. A child can't learn, a child can't comply with what's expected of them in the classroom if they don't have a safe home. If they don't even have a home, but if they are a victim of some other trauma, regular exposure to domestic violence, regular exposure to unstable relationships, that child is not going to be able to sit in their seat, as we discussed, and learn.
What about this? Anyone who says this is the reason why teen bullying and abuse takes place, it's not really a good conversation, a healthy conversation, because there are so many, as you said, factors. But one of the areas we did get into in the panel that I want to talk to you about, to what degree do our elected officials, particularly at the highest level, the way they conduct themselves, whether they conduct themselves with dignity, with respect for others, and speak in ways without name-calling and mocking people's physical appearance, just saying horrific things including what they are able to do to women because they can. What does that have to, if anything, do with the discussion around teen abuse and bullying? Long-winded question, I'm sorry.
I think it's part of what informs a teen's identity or awareness. If these things are being accepted in the public sphere, if it's okay to debase women, and then a teen can learn that. But when you're talking about, I think somebody in the panel referenced the fact that for a teen, for a 10-year-old, 11-year-old, 12-year-old, their world can be very small. It's not necessarily influenced by, leadership in the country. I think I'm of two minds, because part of me feels that when our role models, I hate to use that word, when our leadership,
they are leaders.
They are leaders, and they set a tone in the country,
and they set a tone
in an extremely public way that it's okay to treat people in unconscionable ways,
including on social media. Which is where a lot of teens communicate.
Exactly. I mean, kids learn from that. Kids see that as acceptable. Now, kids might also see their parents say, they might also experience their parents saying, this is not how we treat each other. This is not okay. This is, these behaviors should not be rewarded.
So it's an opportunity.
It could be.
As well.
It should be an opportunity.
Or there are some parents, and by the way, for those who think this is a conversation about politics, it is not. It is a conversation about the way we interact with each other, the way we treat each other, which is the whole point of breaking the cycle of abuse and teen abuse and bullying. But I'm also curious, there are a whole lot of parents, and I said this as I was moderating the forum, there are a fair number of parents I know who say, yeah, but I separate people's words from their policies or whatever else. Do you say words matter?
Definitely.
Because?
Words matter. Because when you consider a person, they're not just their accomplishments. They're not just what they have achieved. When you understand somebody, you're also looking at how they got to those places. You have the example of the Stanford University swimmer who was extremely accomplished, got into Stanford University, was an accomplished swimmer, had achieved what many parents would see as success, but then, rapes a co-ed on campus. He accomplished many great things in his young life, but he still is an abuser.
And again, an opportunity for parents and those around teens to talk about that. Last question. Why is the Healthcare Foundation of New Jersey, to fully disclose, underwriting what we are doing, and we're not the only entity in the nonprofit world that is trying to talk about this, others who are actually doing things about it, services, helping, resources for teens. Why is the Healthcare Foundation so committed to this area?
We think that the issue of bullying and the issue of adolescent mental health is extremely important. And much of our attention, much of our capacity is to fund organizations to do work in the community to address some of these issues. But another lever that we have to influence public discourse and conversation is to fund programs like yours and to have the conversation take place on a higher level in the community, to bring these issues to others' attention. And it's just one more way that we could try to help the community that we're tasked with.
There is no one solution.
Yeah.
Thank you, Marcy.
Okay.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by PSC&G, United Airlines, Choose New Jersey, TD Bank, the New Jersey Economic Development Authority, the Turl Fund, supporting Right from the Start NJ, and by Horizon Blue Cross Blue Shield of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.